Hi, my name's Dr. Ross Hauser. Welcome to the Hauser Neck Center. I'm going to interview somebody who works here, who's an integral part of the care here at the Hauser Neck Center, Brad Evans. And Brad, I thought you would, well, why don't you explain what you do at Caring Medical, what's your title, and then, what happened to you?
Yeah, so I'm an LPN here at Caring Medical. My primary job is to help Dr. Hauser with patient care. So I just help with the procedure itself. I try to ask the right questions to get an accurate history and make sure they're safe during any of the procedures, and and all kinds of other little tasks that relate to just helping patients move forward with their treatment plan.
And then what happened to you exactly, that obviously I'm interviewing you for?
Yeah, so I was picking up a sock out of the laundry bin, and all of a sudden I had horrible pain in my lower back. And thank God I work here, because I was able to keep a cool mind over, I had just intense, horrible muscle spasms along my spine where it took my breath away. I couldn't even talk. It was very shocking, and it almost made me into a weird laughter. I was so surprised at how awful this was. And so I had to call into work that day. Couldn't come in.
How long ago was that compared to today?
So that was about 4 months ago.
Okay, so 4 months ago.
Yeah. So 4 months ago, and
then... the worst pain you ever had?
Worst pain I ever had. I mean, I've probably had comparable pain, but it was over and over and over again I kept having the pain. So anytime I moved at all, I had that horrible muscle spasm with that pain, and that lasted at the most extreme level for about 2 to 3 days, where any kind of movement...
You did bed rest?
Yeah, so obviously I called you, figured out what we should do, and then so I did strict bed rest for almost 3 weeks. It was bed rest or standing to get up to do.
We thought it was probably an acute disc herniation,
right.
Probably.
Right, exactly,
Okay.
Yep.
Okay.
So at first, before we knew the disc herniation, I tried to see if something maybe just slipped and I was severely out of joint.
Yeah.
So I saw a local chiropractor who, she did a great job. She tried to get me back in alignment. We took x-rays, but we both knew kind of by the end of it, there's probably a disc problem, which is what we thought from the beginning. So since right after that I was in so much pain, I called you for medication. We had to get on a steroid pack just to halt the pain from being so awful. And then we went to, next day, got in for an MRI of my lower back, which revealed L5-S1 disc herniation protruding to the left side on my nerve. After that, speaking with you, the plan was to stay on strict bed rest for a few weeks until I can kind of do some normal functions, and then come in for some prolotherapy.
Yeah, I think you and I, we had, obviously, you think a lot like me, so that's one of the things I admire about you. And I told you when I worked in the VA, a lot of people don't know that, so I worked for 4 years basically at Hines VA Medical Center in Chicagoland. And that was at a time period where it wasn't such a rush to get people out of the hospital. And there is a time where somebody has a medical illness like the flu or an acute disc herniation, where if you just let the body heal it,
Right.
it's unbelievable what the body can do, but we're all so quick to this is hurting a lot, so I'm going to get microdiscectomy, and the doctor's going to take out a lot of my disc.
Right.
So you may feel better temporarily, but is that really a good option long term? So we had these discussions about, you really trying to be at bed rest and just, it's describe kind of what happened, and then how long were you out before you tried to come back to work, or you came back to work?
Interestingly, it wasn't such an easy decision just to stay on bed rest, because you're kind of panicking. The pain is so much that I was like, if I didn't work at Caring Medical, I would have already been to the orthopedic. I would have been already in surgery, because it's just a severe debilitating thing where you start to think, am I disabled? Is it even repairable? And then even the thought of that it's not necessarily just a ligament problem, which is what we treat with Prolo primarily. It's a disc, so you start to have these fears, but I said, no, I got to take my doctor's advice. I help patients with this all the time. So I just got to, stay with the advice. And then I also was very blessed to be able to see at my wife's boss at the time, who's a physical therapist, and she helped explain the McKenzie maneuvers, which were basically leaning in the opposite direction of the injury. So I was flexing when I herniated it. So then if I leaned back, I had relief.
Okay.
And so then I would practice these very gentle exercises. She was able to look at my MRI really briefly. And this really helped me kind of, I'd say maybe get out of the red zone of feeling so terrible. And then it probably took about a week and a half to 2 weeks until I got my first prolotherapy to help resolve the immediate pain and to start the stabilizing process. And then I tried to come back to work for one day around 3 weeks in, and halfway through I started getting numbness and tingling in my glutes and down my left leg, and I started walking funny, and so we knew it's not time yet, unfortunately. So then I had to stay off work for an additional about 2 weeks. And then after that, for almost a month and a half, 2 months, my wife had to drive me to work every day because I was actually unable to sit at all. So at work I could stand, or I could lay down. And so in the car I had to fully recline with my feet extended and a roll under my back because I was totally unable to sit. So luckily now, it's been 4 months and I can sit really as much as I want. Sometimes I feel a little pressure, but I just think I'm on the right track to have full resolution.
How many prolos did you end up having?
4 treatments every 2 weeks.
Okay.
So total 4 treatments every 2 weeks. And then we're likely going to do another one, in about a month or so.
What would you say, what did you learn through the process?
The biggest thing I learned for sure was empathy, to understand what my patients go through.
Okay.
Because to say you're in extreme pain is only so relatable until you're in extreme pain.
Yeah.
So patience, understanding when somebody feels anxiety or fear and uncertainty, and trying to understand that not everybody's so as privileged or as lucky or as blessed as I am to know as much as I do in those situations. So I think that's the first thing I learned. And then I also learned to just be patient and rational, to not take the mindset of fear and urgency, when sometimes you just need to think logically, pray, and talk to your mentors on what you think is the best.
Was there anything that you had done in your past that you think might have loosened the ligaments or something of your lower back, like posture things or being kind of irresponsible with the way you moved, or was there anything, like looking in hindsight? Yeah,
absolutely. There's probably 2 greatest things. The most superior thing, in my opinion, is sitting, generally. Sitting and slouching.
Right.
Not just sitting, but also slouching, because, all of us are bad at it. And almost everybody we know has back pain. And from a functional standpoint, it doesn't make much sense to me that a human is unable to lift something from the ground. I don't really blame any particular lifting as much as I do, why is everybody, not everybody lifts, but almost everybody gets back pain. But that being said, I do think I probably had some ligament issues, and then I was also doing like powerlifting, trying to lift like heavy deadlifts.
Okay.
And there were times where I knew I kind of tweaked it with my form, went bad. But again, I feel like I was maybe susceptible to those tweaks because of the underlying issue, which is the curve in my back was becoming less lordotic. I was sitting all the time, likely contributing to ligament laxity fundamentally.
So there's the global assessment of human disease, so years lived with disability. Headaches, number 1, years lived with disability, meaning that headaches often occur in a young age, and then people live the rest of their life with them. Number 1 was low back pain. So in the whole world, like the years lived with disability, and if you think about it, it's actually the same process. It's like we're hunched in front of a computer, so you're losing the lordosis in your back, then you're losing the lordosis in your neck, and there's so many similarities in the physiology of the lower back. Like obviously, I have a pillow here, but so obviously people, it'd be good, so if somebody's like this, I have the lordosis here, then I have the lordosis here. But once you go like this, once you go like that, you lose the lordosis, and that's, of course, is going to stretch the ligaments. So you're optimistic, and you're probably happy that you didn't end up having surgery of your lower back.
Yeah, I'm extremely optimistic, and at this point, I'm presuming a full recovery. Even at this point that I'm at, even if this is where I stopped, I feel like I'm pretty much able to do all the activity I want to do.
Okay.
Maybe I'd be limited from, powerlifting again,
Yeah.
but I do think that I'll make a full recovery, and yeah.
Pretty much it's what everybody would think. Like initially when people have a microdiscectomy, initially they often, have quicker pain relief.
Yeah.
But really by 6 months, even a year, it's even, as far as like treating it conservatively versus surgery. So, if somebody can avoid a surgery, it's probably a good idea.
Right.
So, and then you were an excellent patient, like you actually listened. Like sometimes in the office you don't listen. But. No, but thanks for sharing your story.
Yeah, absolutely. And thank you, Dr. Hauser, for being there, for taking my call right away, and giving me the advice that you'd give yourself, because I knew that you would do that. So yeah, and I appreciate Caring Medical for taking care of me, giving me treatments, and for being patient as I couldn't come back to work for a while. So yeah, well, thank you.
Thank you.